number one problem for the frozen shoulder, to my experience, I don't know about your patient. I'm not talking about your patient, my patient, because I didn't see your patient. I only see mine. My patient, most problem is right here. This is their problem. They feel like they're so tight, okay? That's number one. Number two, another problem, they feel like there is a bend right here, a circle, a bend right here. Now, if you identify this, the first two primary complaint from the frozen shoulder, let's take care of it. Okay, the first one is easy. I just saw Matt was saying is large intestine, which is correct. He said this is large intestine. Deltoid muscle is large intestine. All right, I agree. Then we do know the first one is sixth meridian is large intestine. The second one, what about the bend? Of course, we do have a large intestine included. Do we have Sanjiao in the back? Do we have lung in the front? I'm sure you took the balance method class already with Dr. Tan and any other practitioner who come out and teach. You do know how to balance this. So you do know the system number two, you can find the balanced meridian the five system. I would do say six because 循经取穴法, the same meridian, okay? 2, 3, you know how to pick them. That's easy, right? I would recommend in my class, I will teach you the liver and kidney can treat the whole, all the meridians on the shoulder. I give you the answer, but I didn't give you the process. If you want to know more in detail why I do that, you may have to register. But it's okay, I'll give you the answer now. All right. So now you do know I have a liver and kidney can balance all these problems. Then we have to go to correct the matrix. Now we have to go to step number 3. For this particular problems, I would definitely recommend you use imaging and mirroring. Imaging and mirroring method. Very, very important. This one for meridian conversion may not be really helpful because it's not strong enough. 2 needle for pain, not working really, really fantastic. If you want it work really, really fantastic, I would recommend you to use imaging and mirroring because this is what is area problem. This is area problem. So if it's area problem, preferable do acupuncture 1, 2, 3. Why? Much more effective, much better results. Okay. Now, you says, 老师, I did put needle in large intestine, liver and kidney, and then I only reduce 50% of the problems. But I'm greedy because I'm balanced method practitioner. I want to do better. Yes, we can. Do you want to add other system? Yes, you can. And personally, I do like to use system number 1 to treat limbs. So if you're still not sure that liver and kidney are good enough, And then I would recommend other meridians with the system number 1. Especially problem from the large intestine, you can see over there, the whole line on the deltoid muscle, that is very, very tight. The arm is really, really trouble. And then they're aching, like pulsating. I would recommend to use stomach. If you want to add stomach to treat large intestine, go for it. Okay, go for it. I would do that too. Okay, so how did you going to do it? If I can find a lake, I would do it right now. Okay, here you go. There's a lake right here. So now, how do I find? How do I do this? Okay, no, it's fine. Okay, now this is the lake that we have talking about. So we haven't decided the right side or left side of the shoulder problem, right? Did we talk about it? No. Now, because of the system number 1, I do need to find the opposite shoulder or the opposite leg to treat the shoulder, because the large intestine and stomach, they are system number 1 has to be opposite side. Therefore, if our shoulder problem is here, and I will use this leg, add from the stomach 41 up to stomach 40, I will insert needles to release the tension of the deltoid muscle. That's the most beautiful image. It's not good enough just to put the needles in. You got to put the needles really deep. Stomach 41, I recommend you go into the hole there, into the joint. 得气 sensation, the needle has to grab. And then evenly distributing, you can do every 1 inch, every 2 inch, whichever way you want. I will do a little bit more. At least minimum, I will use 2-inch needles. The needle tip have to go all the way in, touch the bone and bring it back up a little bit. Touch the bone, bring it back up a little bit. Okay. If you come to my class, I will teach you how to use your needle hand and then the smart hand. Okay. Needle hand, smart hand. That's how I teach. You will know exactly how to make it work, because a lot of students ask, what did I do wrong?
Yes.
You didn't. Right.
A lot of students ask, they probably the result doesn't stay or doesn't last. I think the key is how you needles, right?
Well, is the needle where it's supposed to be? Not if you needle superficial, like you just tap the needles in, it's not gonna work. I'm sorry. Number 2, if you put the needle in, you didn't treat the, for example, if a large intestine 15, that is more tendon and joint. You gotta go stomach 41, tendon and joint. Other ones is not working. Okay? Even though you thought you know balance method, but you haven't seen Dr. Tan treating enough. That's why you're still a little bit unsure. You don't have that confidence because you're not sure that very precise area where it is supposed to be. So yes, unless you watch it enough, then you go back and you tried it and back and forth many times. Otherwise, you will miss it. Okay, you will miss it. But no problem. When that's why when I teaching, I really like to see what is really happen with everybody. How you hold the needle, how did you inserting, and where the needle inserting it. Everybody can talk about the theories, but can you really presenting the results in your clinic? That's the more important. So that's a few things that I like to recommend. Okay, stomach 41, make sure that you're really inserting deep into the joint and the tendon. And the rest, needle goes in, go deep and bring it up to the muscle level, because this is a muscle, deltoid is muscle. And then make patient move and tell them keep on pushing until it work better and better. And right there, you will see the differences. Okay. Number 2, We're gonna needle this the bend, remember here? This one. We have to take care of this part. We haven't taken care of this part yet, right? We only did the first one right here for all these needles right here. This is for the bend. This is the shoulder, right? We only did this part. We haven't do this part yet. What do? Same thing. You have sanjiao, you have large intestine, you have lung. What I will do exactly the image right here. I will eyeball it because you guys may not learning that yet. Before that, eyeball from the ankle to here, stomach 40 is about the end of the deltoid muscle right here, okay? If the bend is right here at the end of deltoid muscle right here, then I would be doing needling right here as a whole thing right here. I would needle the same way all around like a belt. All around like a belt, about this wide. It depends on how wide it is. If it's this wide, this is at least 2 inch, right? If it's 2 inch, you needle the leg as a bell, as 2 inch. Deep insertion. Then the arm will be relieved. And the patient will say, oh my God, that disappeared. And how long you need to leave the needles? 45 minutes to an hour, okay? And then have patient move. If they fall asleep, that's fine. If they didn't fall asleep, you will have to do it. Move. Okay, so that's how I treat it, and the results is really good.